So, good morning everybody. Dear friends, we are going to discuss today on a very important topic in pediatrics, and that is about the nutrition and nutritional disorders. We all know that nutrition is extremely important for survival as well as growth of the child. Now, how the nutrition is important? Whatever we consume as a food, the 50% of it is used for the daily activities, physiological activities in the form of circulation, digestion, excretion and respiration and various physiological functions going on in the body. That is called as basal metabolic activity. So, the 50% out of 100, say 50 calories are being consumed for these vital functions. If we don't take this much food for or the calories, then these functions are likely to get depressed. Similarly, 25% are used for the growth of the child, and around 12.5% are used for the activity, like say day-to-day locomotion, play, sports, and whatever the activities we undertake or a child undertake in day-to-day life, that consumes almost 12.5%. And then the remaining 8% or 8.5% is used for the purpose of excretion and the specific dynamic action of the protein. That means for metabolism of the proteins, you need extra calories, and that is for the specific dynamic action of the protein. So, this is how the calories or the food consumed is utilized in the body. Now, how much calories we get from the carbohydrate? 1 gram gives 4 calories, while proteins also gives 1 gram gives 4 calories. On the contrary, the fats gives 1 gram of fat gives 9 calories. So, this is how the calorie consumption of the person occurs in the body in different types of food which is being taken in the body. Now, as the child is born, we know that the child needs a nutrition, and the best type of nutrition what is available to the child is the breastfeeding, and therefore it is known as the best biologic option for a nutrition of a newly born baby. Right, coming to the why we are so concerned, it is being found out that as per the recent data of National Family Health Survey 5 which was conducted way back in 2020, showed that the infant mortality rate is 23, while the under 5 mortality rate is around 28. Now, this mortality is because of what? Let us see that the perinatal causes like prematurity, asphyxia and the neonatal infections, they are responsible for almost 18% of the mortality. Then the upper respiratory and the lower respiratory infections in the form of pneumonia, they are responsible for almost 19% of the under 5 mortality. And the say diarrheal disorders in the child under 5 years, that takes around say 19% of the mortality, and measles and malaria takes almost 7 and 5% of the mortality, and other conditions like vaccine preventable diseases, accidents and so on, they are accountable for almost 12% of the under 5 mortality. But over and above, they constitute only 55%. The major chunk of 45% of the mortality is related to the malnutrition in children in developing countries, including India. And therefore, it is very much important to know the importance of nutrition in the under 5 child, particularly in newborn babies and below 5 years of age group. So, malnutrition accounts for 45% of the deaths in children below 5 years of age. So, therefore, nutrition has got a very important role, and we should be aware about the importance and various factors which are related to the nutrition of the child. Now, we know that the breastfeeding is known to mankind since its evolution since antiquity, since the person is being born or since the human being is born or has existed in the environment. Now, ignorance, however, and misbelief and modernization has declined the incidence of breastfeeding to as low as 30% by the second half of the 20th century. So, it is very much disheartening to know that whatever was existent before say 20th century, that has declined to as low as 30%, and which is a very sad story for the from the viewpoint of the child's nutrition. So, this abandonment of breastfeeding accounts for as high as 3,000 to 4,000 deaths per year, and diarrheal and ARI, the upper respiratory or the acute respiratory infections, they are responsible because of the absence of the breastfeeding. Now, we know that why this is occurring, this is because of the ignorance, this is because of the misbelief and modernization and commercialization of the baby food products, which has made the breastfeeding to a less than 30% of the extent. Now, researches and lessons from recent past has shown that breastfeeding is the best feeding. So, 50% of the mothers need assistance and counseling for the breastfeeding. The mothers, they are to be properly taught about, they are to be given a very much important doctrine about the breastfeeding, its relevance, its importance from the point of view of herself to from point of view of the child and the point of view of the society as a large. Then 25 million Indian nursing mothers are routinely creating routinely doing the lactation and the breastfeeding, and that accounts for almost as much as 4 million tons of milk per year, and that can save the national savings to the tune of 8,500 crores per year. So, the relevance of this breastfeeding is that in short about that the breastfeeding, though known to mankind since evolution, it has declined over a period of time, but this is because of the modernization, commercialization, misbeliefs and ignorance which has given rise to this decline, and therefore these mothers, the prospective mothers, the lactating mothers, they need to be counseled, they need to be taught about its relevance, and they are to be promoted for the purpose of breastfeeding and health of the newly born baby. Now, let us see how this phenomena is occurring. Now, coming to the anatomy of the breast. Breast has got basically three components. One is the secretory component, the second is the supporting tissues, and third is the smooth muscles which are there around the nipple. Now, secretory component comprises of the acini. These are the acini which are producing the milk with the help of various hormones which we will see in short period of time, and the nutrition which the mother takes. Then there are lacteals or the small ducts which carries the milk from the acini to the sinuses, what is called as the milk sinuses, and from the milk sinuses through small ductules it is being carried to the nipple, which carry the milk from acini to the nipple. The supporting tissues, they are responsible for the size and support of the breast, and they are consisting of the fatty tissues and fibrofatty tissues, the blood vessels, lymphatics, nerves and all those things, and the smooth muscles, they are there around the areola which closes the nipple, so that which closes the nipple and the areola, so that milk spontaneously doesn't come out, but it opens up when there is a vasopressin reflex and it ejects the milk from the lacteals to the outside. So, in short, the breast comprises of secretory tissue, the supporting tissue and the smooth muscles. The process of physiology of lactation comprises of development of the breast, what is called as mammogenesis, then the secretion of the milk, what is called as lactogenesis, and the expulsion of the milk, that is called as lactopoiesis. All these three phenomena, they are interdependent on each other. They are occurring sequentially and sometimes consecutively or the simultaneously when the lactation is going on. This particular slide shows you the acini, milk secreting cells and the acini. From there the small ducts are there. These ducts, they carry the milk to the lactiferous sinuses, and from the sinuses through small ductules it carries the milk to the nipple, and they are surrounded by the smooth muscles which closes this particular part so that milk does not spontaneously flow out. This is being under the control of various hormones. The main important hormone concerned with the secretion is prolactin along with growth hormone and other hormones, and the oxytocin is responsible for the muscles surrounding this alveoli or the acini, and then expulsing the milk to the lactiferous sinuses and thereafter to the nipple. So the oxytocin is responsible for the lactopoiesis, while lactogenesis is through the hormone prolactin and growth hormone and other hormones. Right. So this is what about the anatomy of the breast. Now physiology of lactation. As I already said, it occurs in three phases. One is mammogenesis, development of the breast. During the puberty, onset of puberty, there is a development of the breast. The breast tissue increases in size, number with the help of the estrogens basically, and sometimes to some extent like say pigmentation of the areola with the help of the progesterone. Then growth hormone and thyroid hormone also helps in development of the breast. This occurs during puberty as well as during pregnancy and in the postpartum period. Now lactogenesis is nothing but the secretion of the milk, and that is during the late part of the pregnancy and during the postpartum period. And this is done with the help of prolactin hormone basically, which is being secreted by the anterior pituitary gland. Lactopoiesis is expulsion of the milk. Expulsion of the milk occurs in the postpartum period basically, that is through a reflex called as oxytocin reflex. This is what is oxytocin reflex responsible. This is secreted in response, that we will see in the next slide. And other hormones, the complementary hormones are there which are responsible for the lactogenesis as well as lactopoiesis. These are growth hormone, thyroxine, insulin, cortisol and estrogen, progesterone, prolactin, and all these 8 hormones, they are responsible for whole process of mammogenesis, lactogenesis and lactopoiesis. Now coming to the baby itself, what are the various reflexes? These are the reflexes, what is called as the rooting reflex. First of all, the baby searches for the breast. After the moment the baby is delivered out, she searches for a source of nutrition, that is through the help of a reflex, what is called as rooting, that means a searching reflex. Then she sucks the milk and then swallows it. So all these 3 reflexes sequentially occurs in a baby, and this is responsible for emptying of the breast of the milk. Now this is how the anatomy and physiology of lactation is being explained over here. Here you find the upper lip, the upper gum, the nipple, the tongue, and lower lip and the lower gum. These are intricately concerned. So unless large portion of the breast up to the area of the areola is inside the oral cavity, baby is not in a position to suck the milk properly. And this is what is being shown over here. Then this slide shows you that how the milk gets expressed out by the stripping action of the tongue of the baby. She moves the tongue over the nipple, and the gums are pressed over the sinuses, lectins, which I have already shown, and that helps in expulsion of the milk into the oral cavity, and then baby swallows it. So this is the infant gums and the tongue and expression of the milk. Now factors which promote lactation, and that is called as lactogenesis. There are 2 types of factors, enhancing factors and interfering or hindering factors. Enhancing factors are presence of prolactin in the blood. The blood should contain sufficient amount of prolactin hormone which should help in synthesis of the milk, and this is being controlled with the help of the sensory impulses from the nipple as well as the sound of the baby's cry, and that stimulates the hypothalamus and thereafter the pituitary and thereafter the prolactin, thereafter acting on the sinuses, milk sinuses in the breast, and thereby secreting the milk. The sensory impulses from the nipple, then suckling, the moment the baby suckles, even early part of the lactation, just immediately after delivery, there may not be sufficient amount of milk coming out, but even touch of the lip or the skin contact helps in stimulating the milk secretion. Then expression of the milk and emptying of the breast. More the emptying of the breast, more the milk is synthesized and secreted. Hindering factors are incorrect positioning. The mother doesn't sit properly, she is uncomfortable. Of course, if she has got pain immediately after delivery, say for example following cesarean section, in that case the baby can the lactation can get affected. Then the breast not being emptied, they are painful breast or there is an abscess in the breast, then in that case that will interfere. The pre-lactis, if the baby is given say jaggery water or honey water or plain water or any other substance other than milk, that interferes with, because the baby feels satisfied for a moment and therefore complete emptying of the breast doesn't occur, and that gives rise to hindrance in the secretion of the milk. Then artificial feeds and the devices like bottles, spoon, feeding, all these things, they interfere with the lactation process. This is how the process of lactogenesis, enhancing factor, emptying of the breast, suckling, expression of the milk, night feeds, prolactin in the blood and sensory impulse from nipple, they all are stimulating factors and they are the interfering or hindering factors, which is called as pre-lacteals. The feeds with bottles, incorrect positioning, painful breast conditions, all these things are the hindering factors. Then same thing about the factors which promote lactation in the form of lactopoiesis, that means expulsion of the milk. Here you need oxytocin hormone in the blood, and even the thought and affection, sound and sight of a baby, that all stimulates the lactopoiesis. The milk secretes out spontaneously the moment the baby cries, or the moment the baby takes milk from one breast, from the other breast also there is a dribbling of the milk. So this is all about because of the oxytocin reflex and sensory impulses from the nipple. Then similarly confidence. Confidence in the mother is very much important, both for synthesis of the milk as well as the expression of the milk or expulsion of the milk. Hindering factors, they are the like say worry, stress. Mother is not confident, she is anxious about, she has got a shame and embarrassment, doubt and pain. All these factors, they interfere with the lactopoiesis, that means expulsion of the milk. So this is all what is being shown over here. The thought, loving of baby, confidence, sound of a baby, sight of a baby, oxytocin in the blood and sensory impulse, they all are responsible for secretion of the oxytocin from the posterior part of the pituitary. The hindering factors, they are all being mentioned, same thing. Now coming to the what are the types of milk which are being secreted by the mother. The first part immediately after delivery is called as a colostrum. Colostrum is a faintly yellow colored secretion, small in amount, say around 10 to 50 ml per day. The first day it will be less, then go on increasing stepwise over the next 4 to 5 days period. The factors which are essential and optimum in the colostrum, they are the nutritional factors, immune factors and the growth factors. The nutritional factors, it gives sufficient amount of energy for the baby in the first 4 to 5 days of period. Proteins, it is rich in proteins as compared to the mature milk. As we see here in this slide, the colostrum contains 7.5 grams of protein per 100 ml, while the lactation, as it advances, mature milk contains less and less amount of protein. So 3.7, and the after say 24 days or 28 days it may be as low as 0.5 to 0.9 to 1 gram or 1.5 gram per deciliter. So protein concentration is high in this particular colostrum. Then the carbohydrate is there adequate amount, fats are in large amount as compared to the mature milk. You find that the fats in the colostrum is 8.9 plus minus 3.3 grams per set, while the lactation, the mature milk, it contains only 5.2, almost comes to half of it. So the lactose on the contrary, you find carbohydrate is less in the colostrum, but it go on increasing as the mature milk becomes more and more mature. So solid and not fat is more in the colostrum as compared to the mature milk. Density is more in the colostrum as compared to the mature milk. So in short, nutritional factors are very much important. Over and above vitamins, vitamin A and to some extent vitamin E, both these fat soluble vitamins are in sufficient amount or in excess amount in the colostrum. Minerals are also adequate. Immune factors, the immunoglobulins, particularly IgG, IgA, even M to some extent and to some extent D, and small amount of IgE is present in the colostrum, and that helps in protection of the baby from various diarrheal disorders and as well as the systemic infections in the form of sepsis. Lactoferrins are another cytokines which are important for the immune functions. Cytokines and lysozymes, they are there in this particular colostrum in large amount, and therefore it should not be discarded, it should always be given by the mother, and therefore the importance of colostrum. It also has got certain unique properties, what is called as the epidermal growth factors. It helps in the maturity of the intestinal epithelium as well as the skin. Then it also helps in promotion of the platelet derived growth factors, the insulin like growth factor 1 and the VEGF. So all these factors, they are very much essential for the growth of the baby, and therefore these factors are present only in colostrum, not any of the commercially available baby food products, and therefore the importance of colostrum. Moreover, colostrum also acts as a laxative, so that whatever the black stool present early in the phase of newborn period, that is being expelled out, and hence the load of bilirubin also goes down and the neonatal jaundice becomes less and less. Now comparison of the cows and the human milk. Human milk has got proteins, as I said, 0.9 to 1.5 grams. The cow's milk has got high protein. Not only that, the type of proteins which is present in human milk is different. In human milk you get lactalbumin, which is a whey protein, and that contains 60% as compared to the cow's milk, which contains only 20%, and lactalbumin is responsible for the easy digestion and assimilation, and helps in different types of amino acids being present. Taurine, which is essential for the brain growth, and cysteine also, which is present in high amount in human milk as compared to the cow's milk. The fats, particularly polyunsaturated fatty acids and lipase itself is present in the breast milk, which is not there in the cow's milk. The fat percentage wise is almost same, but what is concerning is that the linoleic acid, the what is called as 3-omega fatty acid, which is important again for the maturation of the brain and synapses, that is present in high amount, 10 to 15% in the human milk, which is absent altogether in the cow's milk. And lactose, which is present in large amount in the human milk as compared to the cow's milk. That helps in maintaining the acidic pH of the stool, and therefore prevents from flourishing of the bacteria. Energy load is similar almost in human and cow's milk, 67 to 70 calories per 100 ml, but the calorie distribution from protein, fat and carbohydrate is different. The water content is almost same, the calories is almost same, the ash is more in the cow's milk, the calcium is high in the human milk as compared to the cow's milk. Cow's milk has got more amount of phosphorus, and therefore they are prone to have a hypocalcemia if you give the unsupplemented cow's milk to the baby in large amount. Then renal solute load is very high with the cow's milk, but it is less, and therefore the chances of say development of acidosis, metabolic acidosis is less with human milk as compared to the cow's milk. And oral solute load is again less with the human milk as compared to the cow's milk, and therefore it's very much greatly a milk of preference or choice in a baby who is born premature. Otherwise it can be the cow's milk supposable. Once the baby is stable, of course as early as possible breastfeeding should be restarted. So assure about anatomical adequacy in mother and babies. Then let down or vasopressin reflex present or not, baby is satisfied, happy or not, that all will tell you about the adequacy of breastfeeding. A baby is satisfied, happy, playful, and sleeps for at least 2 hours before crying for the next feed. And this sense of say emotional satisfaction on the face, on the mother's face is very much important. And urination, baby must pass at least 6 times or more per day urine, then only one can assure that the baby is getting adequate milk. And there should be weight gain following first 7 to 10 days period, because in first 7 to 10 days baby may lose the weight. Advantages, what are the advantages for the baby and for the mother and for the society? For the babies it is a complete food, it gives water sufficient amount, it gives calories, it gives protein, it gives fat, it gives amino acids, and everything whatever is required including vitamins and everything. Only 2 things which are lacking in the breast milk is, say for example, vitamin D and the iron. Both these things are not required immediately after delivery, and therefore need not be say given or supplemented right after delivery. Digestible and well absorbed. So the milk is very much easy to digest and easy to assimilate. Availability, no shelf life, and whenever the baby needs a feed, mother can feed the baby. Hygienic, there is no interference in between, and so it is hygienic method. There is a risk of infection being less. It protects against infections, obesity, hypertension, diabetes. So lifestyle diseases, their incidence is less if the baby is being given breastfeeding. And also the chances of cancers, even nowadays it is being said that the incidence of leukemia in the baby is less when they are given breastfeeding. It prevents allergies like say atopic dermatitis, bronchial asthma, allergic rhinitis, all these things, and definitely the necrotizing enterocolitis in the premature babies. Emotional bonding and security is one of the greatest advantage which is offered by the breastfeeding only. No commercial formula can give this. Then higher intelligence and better social and emotional development is achieved in babies who are being given breastfeed as compared to those one who are given the top feed. For mother, it controls immediately postpartum bleeding, because oxytocin, whenever it is released, that gives rise to that stimulates even the uterine contraction of the mother, and that gives rise to control of the postpartum bleeding. Lactational amenorrhea gives rise to spontaneous spacing of the babies, convenient to mother, relief from obesity and diabetes. Both these are controlled because the extra surplus amount of calories, they are being taken away by the breast milk or the lactation, and therefore the obesity is being taken care of. Diabetes similarly also is being taken care of, it is being controlled, and there is a relief from, or they say less chance of breast, ovary and uterine cancers in those mothers who have given the breastfeeding. For a family, it saves money, it saves time, and it saves energy as well. And for a society, child survival is improved, and economy and pollution. The out of say top feeding or the commercial formula, there are chances of so much of being pollution being created, and therefore that adds to the national economy problem. Now after feeding, burping should be done, because whenever the baby takes the milk, some amount of air goes in, and unless the baby is held in upright posture, the air may not come out. So this is what is called as burping phenomena. This prevents the milk regurgitation phenomena, and therefore this is the one which should be practiced. And the development of emotional bonding. This is how the emotional bonding And so these are all the signs of successful lactation. Now, why there is a failure of lactation? We have seen the importance of nutrition in child, importance of breastfeeding as a source of nutrition in child, various anatomical, physiological factors controlling the lactation process, the process of initiation of lactation, how the mother is to be prepared right from antenatal period, how best to start earliest after the delivery about the breastfeeding, and the various advantages of the breastfeeding which are of utmost importance to the baby from nutrition and emotional satisfaction to both baby as well as to the mother. So here we know that ancestors knew the importance of breast. However, freshers must know it as the best. Breastfeeding develops both body as well as soul. Teachings must propagate its role. The role of breastfeeding must be propagated. Breastfeeding strengthens baby and nation both. Why not optimize this nature's creation? Before top feeding alters the biology and you convey your apology, let us all percolate, emphasize and comply the breastfeeding psychology, and that is in short about the importance of breastfeeding and lactation during the prenatal and postnatal period for the baby. Thank you very much.